Hello, my name is Wendy and welcome to the Department of Education at Aspen University. Early Child Education 4.2 Strategy for Classroom Management. Today I will be talking about chronic behavior and intervention. In my objective, I will be talking about introduction, exhibit behavior, chronic behavior, 3 chronic behavior foundation strategy, positive chronic behavior, negative chronic behavior, addressing chronic behavior, foundation strategy for a chronic behavior problem. Underneath foundation strategy for chronic behavior problem, I will be talking about positive behavior support, functional behavior assessment, a behavior intervention plan. Continue on the objective. I will be talking about chronic behavior problem solving technique. Underneath that, I'll be talking about collaborative problem solving and the solution focused brief therapy and the cognitive behavior therapy. And then after that, I will be talking about the 3 scenarios using the 5 restorative dialogue question. And underneath that, we'll talk about scenario 1, scenario 2, and scenario 3, and then the conclusion. Okay, introduction. Behavior issues are common among students in today's school, regardless of whether misconduct takes place within the confines of the classroom or outside its boundaries. Student disruptive behavior and the emergence of behavioral disorder are caused by a wide range of circumstances. This could be due to domestic problem, conflict with a teacher, conflict with a student, or simply the natural progression of time. Behavior issue might occur when a student feels uninterested and bored in the educational setting. The cause of disorderly behavior in school are inherently elusive as they are contingent upon the individuality of each student and their motivation of engaging in misconduct. Okay, the next slide will be about exhibit behavior. When dealing with a child who exhibit behavior challenges, it is important to consider a variety of issues. Various elements can potentially influence a student's life, such as their personal and academic experience, family financial condition, academic relationship, both positive and negative, culture, affiliation, and level of interest in specific course institutionally in the classroom can be effectively adjusted and resolved for specific student. This suggests that a student behavior may vary depending on the situation with the possibility of behaving inappropriate on the day but not on another day. Okay. The next slide, chronic behavior. Chronic behavior in early childhood education refer to persistent and consistent pattern of activity or attitude displayed by a child. These actions are often symptomatic of a child's cognitive, emotional, and social development, and they can have either positive or negative effect. In the context of early childhood education, chronic behavior refers to persistent patterns of behavior that are disruptive, challenging, or problematic. Some specific instances of these characteristics encompass violence, defiance, inattention, and hyperactive. They categorize as chronic because they occur frequently and regularly over a long period rather than being isolated occurrence. Okay, next, I will be talking about the 3 foundation strategy, and 3 foundation strategy are positive chronic behavior, negative chronic behavior, addressing chronic behavior. In the next slide, positive chronic behavior. Positive chronic behavior, these are behaviors that are encouraged in early childhood education because they contribute to a child's overall development. Examples include active participation in class, consistent completion of assignment, and respectful interaction with peers and teachers. These behaviors often indicate child's engagement in learning and their development of social skill. Okay, the next slide would be about negative chronic behavior. Negative chronic behavior, disruptive behavior have the potential to negatively impact a child's social and academic growth. Example behavior include frequent angry outbursts, chronic tiredness, and disinterest in class activity. These behaviors frequently suggest underlying problems that require care, such as cognitive impairment, emotional stress, or social obstacle. Next, I'll be addressing chronic behavior. Addressing chronic behavior. The role of early childhood educator in managing chronic behavior is crucial. Positive reinforcement and encouragement can be achieved by employed recognition, award, and positive feedback. Behavior modification strategy therapy and parent-teacher collaboration may be used to target the underlying reason for unwanted behavior. It is important to recognize that repeated actions do not always indicate an approaching a problem. They can simply function as a sign of the child's growth phase or personality. On the other hand, to protect the child's safety and academic progress, it is necessary to promptly handle any disruptive or harmful behavior. Okay, the next slide would be regarding positive behavior support and foundation strategy of chronic behavior problem. Foundation strategy. One, positive behavior support is a method that focuses on educating children about alternative activity and understanding the root cause of their unwanted behavior. To obtain attention, one can direct a misbehaving child on how to request it more appropriately. The next slide, I will be talking about functional behavior assessment. Functional behavior assessment is a process used to analyze and understand the reason behind a person's behavior, to acquire a more profound comprehension of the factors that contribute to the kid's conduct and the subsequent consequence. This approach entails systematic observing the child across a range of circumstances. For example, if a youngster repeatedly exhibits destructive behavior before math class, arithmetic anxiety may be the root cause. The next slide, I will be talking about a behavior intervention plan. A behavior intervention plan is a method that involves developing a strategy to assist the child in changing their behavior. The method may involve teaching the child new skills, changing the surrounding, or influencing how adults react to the child's behavior. Okay. The next slide will be regarding chronic behavior problem, 3 belief-based problem-solving technique. And the 3 belief-based problem-solving techniques are collaborative problem-solving, solution-focused brief therapy, and cognitive behavior therapy. Moving on to the next slide, I will be talking about collaborative problem-solving. Collaborative problem-solving is a process in which you and the child work together to comprehend the child's point of view and produce a solution that satisfies the requirement of both parties. For instance, if a child exhibits a reluctance to complete their schoolwork, you and the child might work together to create a plan that will make the experience easier for them. Moving on to the next slide, I will be talking about solution-focused brief therapy. Solution-focused brief therapy is a form of therapy that focuses on the capability and resource of the child to assist them in finding their answer. As a scenario, when a child is having difficulty with social skill, one may assist them in recalling situations in which they were successful in social situations. This will allow them to build upon an achievement they have already achieved. Moving on to the next slide, I will be talking about cognitive behavioral therapy. This is the goal of cognitive behavioral therapy, is sometimes known as CBT, is to provide aid to the kid in recognizing the altering dysfunctional thought patterns that are impacting their behavior. If a child is displaying inappropriate conduct because of their self-perception as being bad, you can assist them by encouraging them to question this sense of self-perception and replace it with a more positive perception. Okay, moving on to the next slide. I'll be talking about scenario, restorative practice to resolve the issue, and 5 restorative dialogue question. Okay, scenario, restorative practice to resolve the issue, and the 5 restorative dialogue questions. Scenario number 1, scenario of student bullying takes place. Scenario number 2, a student has been constantly caused disruption in the classroom. Scenario number 3, a student has been found suspected of cheating on an exam. Okay, in scenario 1, the student bullying take place. Question for a restorative dialogue. What happened? Who are the affected individual? How were they affected? What measure need to be taken to resolve the situation? What measure may be implemented to prevent a reoccurrence of this? In scenario 2, a student has been constantly causing disruption in the classroom. Question for a restorative dialogue. What happened? Who are the individuals affected? How were they affected? What measure needs to be taken to resolve this situation? What measure can be implemented to prevent this from recurring in the future? Okay, let's move on to scenario 3. Scenario 3, a student has been found suspected of cheating on an exam. Restorative dialogue question. What happened? Who are the individuals affected? How were they affected? What measure need to be taken to resolve the situation? What measure may be implemented to prevent the reoccurrence of this event? Okay, moving on to the conclusion. Conclusion. Analyzing the child's behavior is essential to identify and resolve the underlying issue according to Accompagner 2013. For example, losing one's home can be extremely stressful for everyone, but especially for little children, and the infant could experience confusion due to the family relocation. Children often display disruptive behavior in the classroom as they struggle to adjust to a new setting after losing a family object like their home. The situation may arise because of unforeseen circumstances that are beyond the control of education institution. And thank you. And that's the end of my PowerPoint presentation.